Hi, my name is Sarah Cisse. Today I'll be doing a breast self-exam teaching with my patient. Um, I'll perform hand hygiene and enter my patient room. Knock knock. Hi, my name is Sarah Cisse and I'm your nurse for today. Would you please verify your name and date of birth for me?
Oh, my name is Edith Ama, and my date of birth is April 27th, 1991.
Okay, Miss Edith, is it okay if I have a seat right here?
Sure.
Thank you. Okay, today you came in, we'll be doing a breast self-exam, but I will be teaching you how to do it on your own at home, okay? So for the purpose of this teaching, I have an orange here and an avocado. I just have both of them to show you some of the little signs that you'll be looking for, okay? Alright, so before I start, just so I can get a history on you, I'm just going to ask you a few questions.
Okay.
Have you experienced any pain or discomforts in your breast lately?
No.
How about any lumps or bumps?
No.
No. Have you noticed any discharge coming out of your nipple?
No.
Do you have any family history of breast cancer?
I don't know anyone.
Okay. Well, the reason why I ask you these questions is because here lately most females that are being positive with breast cancer, they said the first sign that they notice is lumps and bumps in their breast. So that is why I asked you this question before we got started.
Okay.
So today, there are several ways of doing your self-exam at home. So I'm going to be using this orange. So the first way that I'm going to show you is in the shower.
Okay.
So most females like doing it in the shower because they said it's more easier to move around their breast in the shower. So when you're in the shower, they just like you raise your left arm up and you take your right hand. And you can feel, you should want to start from closer to your armpit. So you can either go in a circular motion. So you can use light and deep palpation. So when you have the soft tissue here, you can use light palpation. You go in a circular motion until you get over here. You come back here and start and go in a circular motion. But when you're by the nipple where it's a little hard, you can press more harder. While you're palpating, while you're doing the circular motion, do a little more harder. And then once you're done with this side, you can go ahead and repeat the same thing on your left side. Use your left hand and do your right breast. You can do that in your shower. And then the other way is once you get out of the shower or anytime you can stand in front of a mirror, you put both of your hands on your hip and you just want to look at your breast. You're looking to see if you can notice any bumps, any lumps, or if there's any drainage or discharge that's coming out of your breast, or you're looking for the symmetry, that is if your breast is equal or not. But it is okay if one breast is bigger than the other because that's like a normal thing for most females. One breast is usually bigger than the other. But if there's any visible lumps or bumps, these are signs to look for and notice your physician. And also, if you notice any wrinkle, like if you look at the avocado right here, you can see those lines going through it. It's not as smooth as an apple could be. And then if you notice any, see this rough edges here on this orange. If you notice that on your breast, again, that's another sign to look for. Also, if not, because this is here, if you take it out, you can see like a dimple, like a hole. You see the lines that goes through. So if you see the line at a particular spot of your breast and have like a little hole, like a dimple, that's another sign to look for as well. Okay. So you just look at your breast in the mirror like that. And then after looking at it, if you want to repeat that same motion that I told you, you can do it again in front of the mirror. You raise your hand up and you start closest to your armpit. You do it in a circular motion. You go until you come to the center part and you repeat it. And then when you come to the breast, you want to push a little harder so you can feel any abnormal bumps. The other motion that you use is like horizontal, like you can palpate downward like that and you come up and palpate. You do light one on this adipose tissue, the fatty tissue, but when you come here, you want to palpate a little deeper. And then you repeat that until you get to the mid part of your breast. and then you stop that one and continue the other one as well. Then the other way to do it, may I sit down? You can lay down flat in bed. So they call that a supine position. You lay down and you're looking up your ceiling. That way your breast it's kind of, it just spreads out. You can also repeat the same step either in a circular motion or you do it at that angle, like in a line form. So you just go like this, downward, like that, on your breast, like that.
That's why lying on your bed.
Yes, you can do that both while lying and one standing or in the shower. Or if you prefer the circular motion, you go in circle like that. You continue until you done the whole breast like that. So, and then the other one, you can sit down, like sitting down right now, and then you can still do it. You raise your hand up and do one at a time. You can either do the circular motion or you do it like in a line form. You go down horizontally, you come back and go down, or you can do it in a circular motion like that. Always when you go to the where it's more hard, you want to push a little harder, so you can feel for any lumps, and if it's tender. But now it is recommended for a female to do it after their menstrual period, because during your menstrual period or before it, usually the breast is tender. So if you're a female that fall within that characteristics, it's recommended to do it after your period. But for a female that is in menopause, that has passed menstrual cycle, you can do it any time during the month because you don't go through that phase. So it's always advised and recommended to do once in a month, but they always want it to start like at the age of 21, and then you do it as you do your you do like the one you come into the hospital when you do your pap smear. That's another test female do. You do it together with that. So it's always recommended for that. So based off what I've explained so far, do you have any question for me?
Well, I don't have any question.
Okay. Would if you don't mind, would you please demonstrate for me what I just teach, what I just taught you?
Yeah, according to what you said, I will only talk about two types, as you have explained to me, which I would like to do. The first one was while I will be taking my shower, I can raise my hand up, right hand up, then I use the left hand, to move it around, swirl on it. Then when I get to the hard tissue, I try to press a little harder to see if I can see any bumps or anything that is unusual,
Yeah.
So after that, I have to raise my left hand and then use my right hand also to do it.
Okay.
Then another type, which I will also prefer, is standing on the mirror to look for any discoloring or any lumps or any swell up or anything that is, abnormal.
Yeah.
I think that's the two types I would prefer to do.
Oh, okay.
Yeah.
Well, thank you very much. It's okay if you can't do all the laying down and sitting down. As long as you're able to do some, that's good. Okay, so I have this documentation here for you. It's just a guide. This is what I use to be able to teach you today. I get my information from Mayo Clinic. But also, if you need more information about the breast cancer, you can go to American Breast Cancer Organization, their website, and get more information related to that. This one just have the guide and the steps that you can follow. So if you have any question or if you forget while doing your test on your own, you can always read and look through that.
Okay. Thank you very much. I'm grateful.
You're welcome. Thank you.